Hi folks, Kevin here. Well, today I want to talk to you about owning your own health care. This day and age, there's so many concerns about, Obamacare, Trump care, whatever it may be. This is the beginning of 2017, March of 2017, when I'm making this video. And so many people are worried about not having the health care insurance, and many people have chronic diseases. Well, this little presentation isn't just going to cover those people who have chronic disease processes, but it's going to encompass much more than you, the individual viewer. So there's a few steps to owning your own health wellness program, and it all starts with first, realizing who are those people that you really care about. What are their names? What are their ages? This might be your children, your siblings, your parents, your grandparents, and so on and so forth. The people that you really care about. And getting all their names and starting to gather data on their health status from when they were children all the way up to their current age. And that would list problems that they had. It starts off with a problem list, a list of, geez, Grandpa had polio when he was a teenager, but he recovered from that, hasn't had any problems since then. Grandpa was in Vietnam and was exposed to Agent Orange. We think that may have contributed to some of his health care issues. This is a list of his health care issues, and that's a little bit of history and the problems list. So knowing that we have allergies to certain drugs or medications, knowing that it can be certain items. We have severe reactions to poison ivy or poison oak, whatever it may be. Getting a detailed list of all of the problems that your loved ones have had, and then chronologically putting them in basically like a historical database. And where would I keep this? Well, where I keep my data is in what's called Evernote, and that goes across all platforms: Mac, DOS, Windows, Android, iOS, any device, Linux. It goes across all platforms. And I think it's good to have something that actually goes up into the cloud, besides going on to your computer or your phone, that you can keep all this information. Heaven forbid you're on vacation in some location and there's an injury and you no longer have access to your digital device. Well, if there's power and they have a computer system at the hospital or the doctor, well, then you can bring up that Evernote data on that device and share with them the whole history. And the medical history is really important for the clinician to be able to respond appropriately and timely. It removes a lot of the guesswork. So owning this responsibility is really, really important. So again, starting off with a list of the people that you care about and that you want to be able to provide service and support during their time of need. And this includes yourself. Listing all the problems that the person has had throughout their life. Listing chronologically when those problems developed, what the treatments were, what the responses to those treatments were. Was there a partial improvement, moderate improvement, or the problem seemed to completely resolve? You want to gather data from your doctor's office, the hospital that you stayed at. Get as much data as possible. Certainly getting laboratory data as well, the actual blood results, not just the doctor's notes. Imaging as well. So if you're at the doctor's office and they take radiographs of your x-rays, you call them x-rays of your limbs or your abdomen, or they do a CT. Nowadays, they may charge you $2, $3, $4, $5 for a copy of that. Get a copy of it. That can be put in your database as well. Just so that you've always are taking responsibility for all that data for you and your loved ones. As far as lab results, let's say you've had some chronic problem and routine blood work is being done, or routine urinalysis is being done over time. Actually, a trend in your data is more important than any individual specific value. So you may have a red blood cell count that's always at the low normal level. and you've never had any problems with it, you're an athlete and you do well. If you have a high normal level, then there might be an indication that there's something going on. Or if your creatinine, one of your kidney values is typically at the low normal level and it's creeping up towards the high normal level, well, some clinicians may say, well, that's not such a big deal, but the trend is indicating that there potentially may be something going on in your body that needs further investigation. So I hope that first part makes sense. Now, another really important thing to consider is choosing your doctor. You have the responsibility of choosing your clinician, your physician, your surgeon. And that starts with knowing what your goals and beliefs are. Nowadays, some people really prefer going to a chiropractor, an acupuncturist, a homeopathist, I'm not sure if that's the proper term, an herbalist, a osteopath, a holistic doctors, whatever it may be, understanding what it is. I think having contact with the medical profession and getting routine results is beneficial ultimately in the long run. Now I'm looking at it as a retired veterinary internist, and that data over time really does help out. However, having said that, there's pressure on clinicians to generate income for the practices that they work at, and this goes from all practices, whether it's the big corporate practices that have basically taken over the hospitals, to the multi-doctor practices in the various communities, to veterinary offices as well. There's pressure on them to spend as little time with you as possible, to potentially sell you stuff as well, or to push certain medications on you. And when it comes to lab results, one question you should always be asking the clinician is, well, if you run this test, how is that potentially going to change the way that you're going to treat me and help with my problem that we're trying to address? So that's an important question to ask, because sometimes diagnostic testing potentially pose some risks, or they cost more money, and if it isn't going to potentially benefit you in some way or give that clinician the edge on knowing, you know what, I'd rather go down this treatment protocol than that treatment protocol. So I hope I'm not getting too confusing with throwing too much out here at one time. So another really important component is finding that clinician that's going to work with you after you've identified, geez, it's nowadays I hear so many people saying, geez, I want to go the holistic route and I want to stay away from traditional Western medicine. And I can appreciate that given some of the stories that I've seen and that I've heard. However, being Western trained, and I certainly would say there's value in having a Western trained clinician, and we are reductionists. I'm more of a holistic doctor, and when I say holistic, I'm talking about the whole body. Mind, body, spirit, health, all aspects of health. However, you need to share with your clinician or physician what your goals and aspirations are. So I'd say if you don't have a health care provider yet and you want to establish a relationship with them and get records from your previous experiences with doctors in the past to them so that they can evaluate the situation, pay them, sit down and have an office visit with them and see, can you develop a comfortable relationship with them? Share with them what your goals and aspirations are. I know that seems very odd, telling your doctor what your goals are, but that should be done with all clinicians. These are my goals. I want to, my shoulder's been bothering me and I want to achieve full 100% range of motion, and I want to reduce my pain by 75%, whatever it may be. Sharing that, and they may say, well, you know what, I don't think that's realistic. And I would say all of this information, you just need to process and see what sort of relationship you can have with this clinician or physician. The other thing is, if you're interested in using herbal supplements or having supplements, you need to have an open dialogue with the clinician as well. Let them know what it is that you're planning on taking or interested in taking, because they may have some legitimate concerns about those potential treatments. So I think I've covered most of what I wanted to talk about today. So being prepared for that unforeseen event, and I guess I would just say this, as an internist who's dealt with many chronic and debilitating disease processes in dogs and cats, as an emergency clinician years ago, and as a criticalist, an internist that developed a critical care practice in the practice that I worked at, I saw many people over the years who were actually in shock when something catastrophic happened. And when I would mention, geez, you know, your loved one is in a coma, or they need to be on a ventilator for the next 2 days, or they're going to need several blood transfusions, or whatever it may be, people, in my experience, often get a little bit glazed over, and you get in shock when you hear stuff like that. So one more key element that I'm going to mention now is, and this goes when you're meeting with your doctor for the first time, make sure that they're comfortable bringing a recording device into the environment. Always have a phone that's fully charged, or a backup battery system, or a recording device that you can bring in and sit down. The doctor's time is very valuable, and they're going to use terminology that you're not absolutely familiar with or fluent with. And it's very important for them to be able to disseminate as much information as possible in a relatively short period of time, and often people are overwhelmed. So I would encourage people, always bring a recording device every time they met with me until we really got down along the journey of recovery, where people were very comfortable. Because I'd encourage my people, go on Google Scholar and look up these terms and all, and see if you have questions about what we've discussed. And I'd be very detailed and use both appropriate medical terminology and layman's terms as well when I would go through, describing what's going on, what the options for treatment are, and what the potential outcomes of each treatment path that each treatment path that were possible. And this takes quite a bit of time from the clinician or physician that you're speaking with. So I think that those things are very important, and to be aware of that. So always have a recording device. Do your prep work. Get your history for the people that you care about, the loved ones. Get the data. Don't assume that your wife or that your husband's going to remember all this stuff, or that the doctor's office already has all that data. Those offices could be closed. This day and age, there are many different, not just disciplines, but there are many different owners of various practices, even in a hospital. And it's a challenge to get fluent communication when it's an off hours, after hours, emergency, or critical situation. So that's my basic introduction to owning your own healthcare with respect to preparing for an emergency situation. Owning our own health is really a big topic, and there potentially could be many more videos covering various aspects of really, acknowledging that we need to take full ownership of our health and well-being. I'm a firm believer that whatever your illness is, chronic debilitating diseases, obesity, diabetes, cancer, cardiovascular disease, so many of these diseases are manageable and potentially reversible by appropriate lifestyle medicine. Well, thanks so much for watching the video, folks. I appreciate it. Please give us a thumbs up if this was of value. Please share with your friends and family. I really appreciate it. Owning it is what it's all about, and taking care of ourselves. Self-care is of paramount importance, and we need to take good care of ourselves so that we can take good care of our loved ones. Take care, folks, and have a great day. Bye-bye now.